really it was very struggling for almost 5 years. I had my lower back problem. It's affected on my left leg, and I couldn't like walk like too far. Maybe it was like 3 or 5 minutes. That was the longest time that I was able to walk. It was very challenging at that moment. So it was started 2013 actually. I fell on the tub, and then I didn't say anything at all, because for us, like as Filipino, we're just, oh, I can get up. I was okay, so I didn't say anything at all. After 1 week passed, and then I was tying my shoes, and then I heard my back popping. So that was the start, and that's on and off, like going to the therapy, injections, and everything. So it didn't work. And then I worked at the Christ Hospital, um, for as a patient care assistant, and then I was at rehab unit. So of course that was not easy job because of the patients, and then maybe that was also like it's not maybe in not really help helping with my situation, but of course it's not too picky because you're looking for a job. But then it started like 2021 after COVID. So I was working at that time, and then it was 10 o'clock in the morning, and I told my manager that, because I was 12-hour shift, so day shift. So I told her that I don't think I'm able to work until 7 p.m. And then she said, what is going on, blah, blah, blah. And I said, my back is really hurting, and I'm hardly able to walk. So, and for her, at that time, they were just, thinking about short stuff. So, and she said, like, do your best. How am I able to do my best if my back is really hurting? And then how am I able to, take care of my patients, which is I'm not able to take care of myself. So I walked out. I called him, like, I'm in trouble. Blah, blah. So, yeah, and that was it. Like, they sent me to the doctor first at Christ Hospital for surgery. Sad to say, it was failed. That is called like failed surgical whatsoever.
Failed
So it
surgery.
was like laminectomy and disectomy, and it failed. So after that, it was like 2 months past the first, and then pain came back, and then looking for another doctor. So the pain management doctor suggested for this spinal cord stimulator. So I had a trial, and then um, at first it was success, like that. The trial was success. I had an implant after 2 or 3 months passed, or something, or more than that. It's not that long. And then the pain came back again. So, I could understand why. There's a lot of whys. Why is it going on? What happened? It was a success trial, but then why is it all of a sudden why my pains come back? So, and then the doctor said that we tried many times for all the settings, until one time I said, I give up. I don't want to do this anymore. I want this to get removed. And then next is that was my first spinal cord. Next is another spinal cord stimulator, which is from Boston. Okay. And then again, I looked through with a trial, blah, blah, blah. It's the same thing. And then it's still, like the pain came back again. So it was very devastated on my part. I was very disappointed. It was very frustrating.
She was falling 2, 3, 4 times a week.
And you were using a wheelchair as well, I think?
Yes.
Oh,
yeah. I have 2 wheelchairs, 2 canes actually, and 1 electric scooter. So, So I was using a wheelchair at the time.
Your fusion was in 24, is that correct?
Yes, 24.
24, because
Yes.
the, after the fusion didn't do as good as with the, that's when the nerve in the leg was still damaged.
Yeah.
Yeah.
And the falling just continued. It didn't stop.
Yeah.
And so, was it, yes, TriHealth was one that sent us here.
Yeah. I forgot her name.
Yeah.
Dr. Fortman's assistant. So, and then she said like, I have another option for you. So, like this pain implant. And I said, again? So, it's because I've been through a lot. And then now she's mentioning about another implant. And I said, how many times do I have to do this one? Until I really I find my, like, really for me.
Yeah.
It works for me.
Yeah.
So, finally, and then, we talk about it. And I said, but at that time, I was still not convinced yet. So, but then, and I said, you know what, if I wanted to be healed, if I wanted to walk again, I gotta do this, I will try this again and again and again. So, yeah, she set an appointment with Dr. Danko, so yeah,
Well,
that's why I'm
in
here.
the meantime, after we talked about the implant, I talked to my sister, and she said, oh, I have a friend that had an implant, vein pump implant, and says it's done a wonderful job for her. Well, that kind of tipped us over.
Yeah.
Yeah, so yeah, that was helpful.
Yeah.
Yeah. So yeah, it was. So now
Here you
it's
go.
not even a year yet.
No, it's
after-
November last
Yeah,
year.
November last year, and I think like after the implant, my implant, it's November. I was able to like 3 weeks after that.
Yeah, it took about 3 weeks to get you stabilized a little,
Yeah.
2 months.
Yes, and then yeah, I'm here and able to walk. I'm back to my feet.
Yeah.
Although I still have pain, but it's tolerable.
Yeah.
I can manage the pain. So I'm able to do my cooking, the baking, so it's kind of like, yeah, it's. I am so much better than before.
Yeah.
It's sometimes it's like, oh my gosh, it's hard again. So but I'll just take some Tylenol and muscle relaxer that, it helps. So at least like 85 to 90%.
Yeah,
It's-
that's pushing it.
It's I think I'm just really like
Optimistic in here.
I know that it's not that much. In March, she did really, really great from November after she got kind of healed from the surgery.
Yeah.
Until March, it was fantastic. And I personally think she overdid. She was so excited that she could do something.
Yeah. I think that's.
And,
Yeah.
and I think she
Yeah.
overexerted. And so in March, it was down to tubes for just about a month.
yeah.
It was a bad month. And she fell 2 or 3 times in that period of time. It was like, but this time she was getting a little bit frustrated and very disappointed because I'm right back to where I was at.
Yeah.
Yeah.
But she was able to get stabilized and slow down.
Yeah. Right.
I mean, she was so excited to be able to walk and stuff. And sometimes the problem hadn't gone away.
Right.
It was just helpful. So I think you overdid it by just being so happy.
Yeah.
Yeah.
But now it's, from my standpoint, she's gotten back to a point where at least she could walk decent. Don't have to worry about falling every time you move.
Yeah.
She still has a lot of pain, I know that. And especially during the night when she can't lay on certain spots very long at a
Yeah,
time.
because it's very uncomfortable.
I saw you holding your back when we walked in here. Are you having some issues today?
Yeah, on my right side.
Yeah,
Yeah, that's why I'm like, don't forget, like I have to mention this one too. Dr. Danko, because on the right side is like, it's hurting. It's been 3 weeks now.
Oh, yes.
So, and then when I sit down there, and then I kind of like, when I twist it, I'm like, oh, shoot, it hurts. Then, so yeah, that's what I'm like, oh, shoot, that's right.
From my looking back and watching and seeing, one of the things that the implant has done, it has given her some relief and peace of mind that she's not gonna fall every time.
Mm-hmm.
She can't do like she used to by no means. I mean, that's a simple fact.
Yeah.
But the level of comfort is, I'm gonna say, no more than 70, 75 at the max. But it's a good 60 to 70 all the time.
Where do you think you were before all of this? Last November?
Oh, like 10%.
Okay.
Yeah,
Oh,
no,
shit.
it was bad. It was just really bad. So, yeah, and then if they're going out, I'll just have to stay in bed, and then the wheelchair's beside on the bed. So, yeah, they're just gonna put some water, some crackers on the
Yeah.
table just in case, and then, it was.
Could hardly leave her.
Yeah. And,
I mean, somebody was with her almost all the time.
yeah, that was bad.
Well, I'm glad you're back to being able to do things again.
Yes.
That's great.
Yes, I'm so grateful.
Did you have anything else you wanted to add?
The only thing I would add to that is the fact that the discomfort level was horrific before. Really, she was taking morphine by oral method, and as Danko explained, oral medicine is like this, where this she's doing now is like this.
It's a constant, yeah.
And that's the difference.
Yeah.
We could tell it almost immediately. Once the meds got in there, after a couple of weeks, you could really tell the difference.
Mhm.
Perfect.
Yeah.
Thank you so much.
Yes.